Yes, thank you, Speaker. I have a petition to provide out-of-country treatments for Ehlers-Danlos patients, brought forward by Erica Crawford and her family. Over 8,000 signatures here. Speaker, to the petition to the Legislative Assembly of Ontario. Whereas the Canada Health Act requires provinces to fund medically necessary treatment for Canadians, and whereas a growing number of people in Ontario suffering from Ehlers-Danlos syndrome, EDS, have to seek out-of-country treatment at their own expense because doctors in Ontario don't have the knowledge or skills to understand EDS symptoms and perform the required delicate and complicated surgeries. And whereas those EDS victims who can't afford the expensive treatment outside of Ontario are forced to suffer a deteriorating existence and risk irreversible tissue and nerve damage. And whereas EDS victims suffer severe dislocations, chronic pain, blackouts, nausea, migraines, lost vision, tremors, bowel and bladder issues, heart problems, mobility issues, digestive disorders, severe fatigue, and many others, resulting in little or very poor quality of life. And whereas, despite Ontario Ministry of Health claims that there are doctors in Ontario who can perform surgeries on EDS patients, when surgery is recommended, the Ontario referring physicians fail to identify any Ontario neurosurgeon willing or able to see and treat that patient. We, the undersigned, petition the Legislative Assembly of Ontario as follows. Require the Minister of Health to provide the names of Ontario neurosurgeons who can and will perform surgeries on EDS patients with equivalent or identical skills to the EDS neurosurgeon specialists in the United States and meet the Canadian Health Act requirements to afford equal access to medical treatment for patients regardless of their ability to pay for out-of-country services. Speaker, I wholeheartedly agree with this petition. I'm going to sign it, as well as those other 8,000 people, and give it to Jade to take to the table.
Thank you.